The patient remains in hospital for several days after the operation. They will then go to a re-education centre for 2 to 3 weeks in order to recover their range of movement. Active assistance by the physiotherapist is not required in our protocol. The patient is soon independent and functional in activities of daily living. The leotard protocol is one of the possible methods of rehabilitation derived from the Tornier protocol. It gives priority to patient independence thanks to its simplicity of design of exercises.
This woman had a right total shoulder replacement 10 days ago. Rehabilitation began with combined elevation and retropulsion exercises. The patient is now doing breaststroke movements to fully wake up the joints and the muscles of her shoulder girdle. Patients, who most of the time are not familiar with swimming pools, are connected to a harness so that they can move in absolute weightlessness. They feel safe and totally relaxed while doing breaststroke exercises. Wake-up of muscles and joints is even more spectacular when performed underwater. Under the supervision of the physical therapist. You can see that only 10 days after the arthroplasty, self-directed passive elevation can easily be achieved. Here, the combined internal rotation adduction movement of the shoulder girdle and the whole chest is being performed. Water at 34 degrees centigrade provides immediate, high thermal comfort since water temperature is just above skin surface temperature, 29 degrees. Furthermore, there is no risk of heat-induced inflammation since the body temperature is 37 degrees. The patient can easily perform a set of 10 repetitions. External rotation, with the elbows floating, provides no constraint. This exercise both wakes up the periscapular muscles and the stabilizers of the scapula while exercising external rotation. Having performed these exercises in water, in a weightless environment, the patient will be able to perform them above water level, against gravity, and will easily and rapidly achieve self-directed elevation, as seen here. Rehabilitation in a warm pool facilitates institution of self-stretching exercises by interlacing the fingers and joining the hands. At 10 days postoperatively, the patient can passively elevate her arms in a supine position in 2 phases, very simply and very easily. Of course, she will also be able to perform this movement while in the sitting position. You will note that this is achieved without the assistance of a physiotherapist. Again, 10 days only after the procedure, this patient has already reached a certain level of physical independence. We are now getting close to the end of the stay. About 1 month has elapsed, and we are going to see how easy these exercises have become. This exercise of combined elevation and retropulsion has become much more natural. Breaststroke movements are still performed with the patient connected to the harness. This is not true swimming. As said before, this is merely meant to wake up the joints and muscles of the shoulder girdle and chest. You will note that no flotation devices are used, because they increase the resistance of water and might cause painful inflammation and postoperative stiffness. Patient performs a set of 10 slow repetitions. There are 2 sessions of 30 minutes each day. During underwater exercising of self-directed passive elevation, the patient wears a lead belt on the thighs. We have noticed that the recreational aspect of this method increases in efficiency, as many of our patients who have never been underwater before are able to do so during the rehabilitation period. Of course, the physical therapist is always present. He monitors the exercise session and provides advice for this external rotation movement, which is easy to perform. We do not want a given range of motion. Instead, we ask the patient to do what he or she is capable of performing. The combined abduction internal rotation movement becomes easier as the range of motion increases, and a complete physical exercise that the patient performs in water and then out of water, since all of the exercises performed in the water can be done on dry land, both morning and evening, and are perfectly suitable for patients of this age. In the back, you can see a patient who has received a reverse prosthesis performing exactly the same exercises. 1 month after shoulder replacement, you will note that in a patient with a standard shoulder prosthesis, self-directed passive elevation in a standing position is achieved without any difficulty. This patient will soon leave the rehabilitation center. She's able to self-mobilize in the supine position, performing a few repetitions each time, several times a day. Stretching exercises in the supine position are more relaxing. She'll perform this exercise in the sitting position, again a few repetitions at a time, several times a day. Stretching in the sitting position promotes wake-up of 108 muscles of the shoulder girdle.
C'est le seul exercice, hein? Oui.
This patient is about to return home. We'll see her again at the 3-month follow-up visit. This is the 3-month follow-up visit. Complete assessment includes radiographic evaluation, an interview to evaluate pain relief and ask the patient if she takes pain medicine, evaluate the quality of her sleep, and ask the patient if she can sleep on her new shoulder. Evaluation of all ranges of motion in the supine position, and a comparison with the contralateral shoulder in both elevation and external rotation are performed. The arm is gently elevated, and the elevation is measured relative to the plane of the table. Then, external rotation with the elbow close to the body is assessed, again without any undue force. Now, with the patient in the sitting position, internal rotation with the hand to the back is assessed. Internal rotation is often more difficult to improve than the other ranges of motion. After that, we measure active elevation in a controlled sitting position, hands behind the head to avoid compensation, and active external rotation, what we call external rotation 2, is demonstrated here. Lastly, we test the muscle tone. It is not a measurement of muscle strength. Muscle tone is assessed in external rotation, overall muscle tone in elevation, and the subscapularis is assessed by using the belly press test.
Hello, madam. Good to see you again. How are you? Very well, thanks. Oh, that's great. Well, we're now at 3 months post-operatively. 3 months for this one, 1 year for the other. This is incredible. It's better on the right than the left. Yeah, yes, the right. This is good. Come down and now do like the leotard stretching protocol. Like that. No, without turning the hands. It does not matter. That's it. Come on. This is perfect. Come down. Can you also do this one? That's very good. It can't be done better. Are you still doing the pool exercises or are you only doing the stretching? No, I'm only doing the stretching at home. This is perfect. Nothing more, nothing less. We continue even if there is no problem because it has become easy. But you must do this every day. We're now at 3 months post-operatively. We will evaluate the situation again in 1 year's time. Very good. Is this today's radiograph? Yes, I've just had it taken downstairs. It's perfect too. Everything's going fine. Thanks for agreeing to be filmed. You're going to be famous.